Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Pediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London. One of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who's kicked like a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Try and do the weights. Wait, look, watch, watch. Boom.
What's the next one? Beautiful anime lover I saw on the number 75 Bristol bus. Did you put that in? It's from Bearded Guy. No, I don't think we've made it in this one, mate. No, I don't think so.
Let's just staple his head first. He's got a black on his back of his head, which we're going to staple. Okay. Once we've stapled that, we'll basically get the NG tube down. Are you happy with that? Or you're not happy with that?
Yasser first came to St George's as a medical student 17 years ago. Today, he's the consultant in charge of resus.
At the moment, probably okay, actually. But you can thank Manny for the gesture. It was probably about 2 seconds after the cord was clamped when I was born that my parents probably decided they wanted me to be a doctor. They didn't really give me any subliminal messages when I was young. They said, we want you to be a doctor, we want you to work hard at school. Do you know where you are at the moment? Do you know which hospital you are? I'm a doctor, my wife's a doctor, my brother's a doctor, and his wife's a doctor. No problem, don't worry, you're at St George's Hospital. Yeah. I'm going to just have a feel of your neck. My mum's a doctor, my dad's one of 11 siblings, of which 7 of them are doctors. I think it's just one of those things in Asian families in particular that there's a sort of, this is what our family does. Hi, it's Yasser. Who's that? I think in the back of my mind, me and my wife would probably both want our children to be doctors. My son probably wants to work for Lego. I'm sure they need a doctor. Just give me a second, I'm back with you.
Hello, St George's A&E. Adult medical, paediatrics, trauma or medical? Yep. Thank you, bye.
Pediatric trauma call, 15 minutes.
A 5-year-old boy is being rushed to A&E after being hit by a car and trapped underneath it.
Is it a trauma?
Yeah, 5-year-old loads of RTC, but he rolled under the car and they've said he's got a significant head injury.
I think with children it can be very emotive. From my point of view, personally being a parent as well, you'll tend to think of your own children. Amber, do you want to do primary survey or do you want one of our team to do it?
You do?
The family members may be very, very upset and anxious. That's much more exaggerated when a child comes in as opposed to an adult.
Witnesses at the scene of the accident had to lift the car off the child for paramedics to treat him. His dad is travelling with him in the ambulance.
My boys, they go to the mosque after at 5 o'clock, after school basically, and it's just to brush up on their Arabic, learn how to pray and stuff like that. Normally they get dropped back home. Their bus driver takes them to and from the mosque.
It's a trauma, paediatric male trauma.
Sadiq's son Issa was waiting to be collected when the accident happened.
My sister called. She was like, "Are you sitting down? Issa's been in a car accident." It really kind of hit me for six. I wanted to be there. My son needs me right now.
Amber, do you want to do primary survey or do you want one of our team to do it?
Your dad? Do you want to pop
Do you want to do primary survey? Is that all right? Thanks.
Okay, this is Issa. He's a 5-year-old gentleman. He stepped out in front of a car and was subsequently rolled underneath the car, getting caught underneath the front axle. The car has been lifted up manually and Issa has been withdrawn manually as well. On our arrival, laceration above his left eye and around the left temple. Injuries from top to toe. Is complaining of difficulty in breathing with pain in his chest on the right side.
Do we know if the wheels actually went over the...
I don't think the wheels went over him. He's gone in between the two wheels and he subsequently rolled underneath the number plate and the front axle.
Still on the head.
So tell me, what's upsetting, what's worrying you the most? What's hurting the most? Your chest. OK, darling, OK.
Right, should we get him off the scoop and get these collars out of the way first, guys?
Doctors suspect that the impact from the car may have caused Issa serious internal damage, as well as a significant head injury.
Your normal expectation of a young child is that they want to get up, they want to sort of fight or resist you. And actually, he wasn't flailing around, he was actually very still. You're automatically more concerned that there may be more serious injuries. We'll do a chest and pelvic x-ray and basically assess from a head point of view.
Oh, my Johnny. You can hear me, yeah? If anything hurts, you tell me, yeah?
Issa's mother is yet to be informed of the accident.
I couldn't actually fathom telling my wife. She was pregnant, and to see her son in that situation, it would be devastating for her. So for me to break that news to her, I just could not say it.
We need a bomb, please. Yeah, ready, steady, roll. OK, sweetheart, and we'll just stay in that position if you feel sicky.
Well done, well done, well done.
I just felt so helpless. And I was just praying to God, I was like, if it's all scars, it can be healed, but just make sure there's nothing else that he may not be able to recover from.
X-ray, phone fine.
It's been 14 minutes since 5-year-old Issa arrived in A&E, having been knocked down by a car, trapping him beneath it.
What is going to happen, though, is we just need him to stay really still during the scans. We'll get you to come just be with him whilst he's there.
He's been x-rayed and doctors are sending him to CT to scan for any head or internal injuries.
OK, he said they're just going to move you onto another little bed, yeah? But you have to just be still, OK?
Issa's mum, Tara, has been informed about the accident and is on her way to A&E.
Ready, steady, slide. There we go, well done.
I'm blessed in the way that I've got a wife, I've got 5 kids, and they all bring their own little touches into the family. With Issa, You'd be sitting there and he would just walk into the room and he would just come and kiss you on the cheek.
They're going to put you in this machine that's going to check you, okay? Right? They're going to check all your head and body and everything, okay? Issa, just don't move.
And fortunately for my boys, they're in a lot better off position than we were when we were growing up.
Don't be scared. Daddy's in the room, okay?
My mum and dad came over from India. They came from a kind of a poverty-stricken background. My dad had his qualification, but he had to do like the T-boy, the paper, sort of like dropping the letters in and offices and stuff, and work up the ladder. He was really grounded about, you've got to work hard because of where he came from. Because if he didn't work hard, you would have not made it.
Breathe in and hold your breath.
And the biggest thing I've understood about growing up in Britain is seeing the opportunities and the vast opportunities that are available. And I want my kids to grow up making the best of everything that is available to them.
Can't see any fractures of his skull. Oh, hang on. What's that?
Well done, champion. Well done.
All right. So we're going to take him back to resus. We'll wait there for the reports to come back, and then basically we'll have a look at him after that.
Specialist doctors will need to examine Issa's scans to identify whether he has any life-changing injuries.
Yes, I'm near there.
I'm going Saturday for 2 nights.
Oh.
Yeah.
What are you doing in pool?
I don't know. I just decided to go somewhere in pool. It looks really nice.
Oh, I cannot tell you like how happy I am just bringing out all these memories. So, where you should go is this.
Donald.
Retired actor Donald has come into A&E complaining of pain in his bladder.
I'm Dr. Nanjani, one of the doctors here.
Yeah, oh, good. What's your name?
Fahim.
Fahim.
Yeah.
Thank you. I grew up during the war. When I was at a very good school, I was at Harrow School.
Will you be able to get on the trolley for me? And
you want me to get on the
if
bed?
you can, please.
I remember I was actually given 3 swishes of the cane for talking too much. All that is now out. You don't get beaten at a school, but I got 3 of the best.
How can I help you? I'll take that stick.
Thank you so much.
Here.
Well, at the minute, I've got a problem with my
catheter. Yeah.
It was last changed, but not so long ago, by the nurse yesterday.
This was put on by the nurse yesterday?
I think it was yesterday. I'm not sure.
Can I ask you a few simple questions?
Yes.
Do you live on your own?
No, I live with my wife.
How old are you?
I'm... I'll be 86 in October.
And can you remember this address, 42 West Street? I'm trying to check your memory.
Yes,
how good it is.
I've done this one before.
You've done this before.
42 West Street.
Ask you to recall it at the end, okay?
Yeah, sure. I signed on to go into the army and do my national service in the Royal Army Medical Corps, because I knew if I signed on, I would stay put in the depot, because in the meantime, I'd been getting myself involved in amateur theatricals.
When was the Second World War fought?
Second World War was fought from the 3rd of September 1939
Brilliant.
And ended in the middle of 1945.
Wow.
Singing in the Rain, that's it. Yes, I think watching Gene Kelly in Singing in the Rain has been one of my goals. It was a lovely thing to watch, and I used to think, oh, I'd love to do that. I really became involved with the stage, and I love doing stage work.
Do you know what year are we in?
2015. My very first solo work was doing old Deuteronomy in Cats, sitting on my tower, my throne, in the middle of the stage.
And who's the monarch of this country?
Who's the monarch? Queen Elizabeth II. I was in Phantom the Opera. I enjoyed Phantom, but my happiest moments were in Cats.
And the address I asked you to remember?
42 West Street.
Okay, good.
I owe a lot to Andrew Lloyd Webber. He really has been my guiding star.
We've sent some bloods as well, and that would give us an indication if you've got infection or not. Now, one last question. You don't feel unwell in any way?
No, I'm feeling just slightly nauseous, but that's because I've not had anything to eat.
Would you like something to eat? You can have sandwich if you
I'll have a sandwich if you have a sandwich, yes.
Fine. Okay, I'll ask the nurse to get you one.
Thank you so much.
Not at all, pleasure.
Just relax your leg down, well done.
Good boy, honey. You are an absolute superstar.
Doctors are running further tests on Issa, as they suspect he may have sustained damage to his head and internal organs after being knocked down by a car.
Is the pain a bit better? Huh? Issa? Issa? Where is it hurting you now?
Chest.
In your chest still hurting?
Issa's mum, Tara, has arrived in A&E. It's the first time she's seen him since he left for the mosque after school.
Don't worry, does it hurt in your fingers?
Okay.
That hurts here, does it?
Yeah.
All right, okay, fine. Okay, spray yourself and gauze.
No, my fingers are on my arm.
Does it hurt over here?
No, no.
Is this mum?
Yeah, this is
Yeah, okay.
I heard that you were super brave, aren't you? It's okay, it's normal. I just don't like to see you like this.
Issa, he pulls at certain strings in my heart I don't think anyone has ever done. He really genuinely makes me smile from inside.
I'll obviously speak to Mum, Dad. It is that all the injuries he has on the initial report.
You have to stay, yeah, you know what it is, you have to keep that around your neck.
I mean, I've always wanted to be those people that, you know, I did want to get married, I did want to have kids. But my life was always work, work, work. I loved what I did. I was a makeup artist. I was happy, but there was always a little something missing.
He's just had his CCT scan and stuff for all the head and all the chest because of his breathing and stuff.
Then I met Sid.
Do you know what's happened? Has anybody filled you in? What's happened?
I didn't know anything. I should just, and then I should buy said to me that he got run over. I only knew that from there, but is he okay, Sid?
He's Tara. Alhamdulillah, alhamdulillah. I really didn't want you to come see this now, Tara.
Obviously, I approached her, and because she's Muslim as well, we don't have like that girlfriend-boyfriend type scenarios. It's kind of like you got to talk to the parents and stuff and get the A-OK. I spoke to her dad. He wasn't too impressed initially, but yeah, we have a little meet-up. She had this feistiness in her.
I found somebody that's very similar to me in the way he was raised in terms of morals, principles, faith.
We're inseparable, and we've been nearly married 10 years.
You know how you do it?
I love her with all my heart. With all my heart.
Aisha rang me and said, look, Issa's been in an accident. Get yourself down there as soon as possible. Dropped everything, shot down there. He was underneath the car, between the two wheels underneath the car after the accident.
Is his chest okay?
Yasser is concerned about the impact to Issa's chest and is looking at his initial x-rays.
So the issue is there is a question mark as to whether or not he may have a small collapse of one of his lungs. And if that's the case, it may need us to sort of put a small drain into him. But let's just take one step at a time. I'll wait for the formal report and then we'll go from there, okay?
Doctors will need to treat Issa's punctured lung, but his CT scans are being examined by specialists as there are signs that he may have further internal injuries.
I think my heart just sank. You know, is it going to be like a lifetime effect on him? How is it going to affect him as a person?
Once we've got all this sorted out, we'll have a closer look at things, exactly what else is needed. All right?
Okay.
Is he going to be the same? Is he going to be the same Issa? I was just petrified.
Roar like a lion. That's fine. Very good.
They're going to cut the ring off here.
Oh, I misunderstood, love. If they can't cut it here...
They're going to cut it off here. This is why you come to a hospital to get it done. It'll be all right, Mum. Just keep it elevated.
Rosette.
Yes. It's swollen.
Yeah.
You know, right after Pilates.
Okay, fine. You were doing Pilates at the time?
Not at the time, after Pilates.
Did you injure it during that?
No, this is it. I think...
How long have you had this ring for?
4 years.
40 years.
You don't mind it being cut?
Well, no, I don't know.
The choice between your finger or the ring.
Exactly.
First time I'm doing this with this machine.
Don't scare me.
It's fine, look, you're going to be all right. Is it hurting a little bit?
It's not actually doing much.
It's like my old can opener.
Just bear with us, Rosette.
No.
We're working.
That's George's A&E.
A 26-year-old man is being brought to St George's after slicing through his leg with a circular saw.
Do I want a trauma mattress on or not? It's going to be messy.
When there is a deep wound to the thigh caused by something like a chainsaw, irrespective of how deep the wound has gone, actually the rotation of the blades may cause much more serious damage to the bones, the nerves, the blood vessels. It's important to try to control the bleeding first of all, but also to try to assess what damage has taken place.
Ready? Yeah. On 3, 1, 2, 3. One here.
Tom, he was cutting some wood, inadvertently lowered his arm, circular saw into his leg. It was a little bit tangled, we had to take the whole saw apart to pull it out. The leg laceration is probably about 20 centimetres long, probably about 5 inches wide. Tom, you ready?
Yep.
Yeah.
Oh, Jesus.
Staff need to urgently assess the damage caused by the saw blade while stemming the bleed from the wound.
I had the labourers round. They were building a lean-to for me. They were using a disc saw. I was showing them how to use it. The blade kind of caught into the trousers I was wearing because they were a bit baggy and just pulled its way through my leg.
Hiya, I'm Louisa. What's your name?
Tom.
Tom.
Nice to meet you.
Where's the pain? Just around the leg or?
Just locally around here.
Okay. Is it throbbing?
It's yeah. Wow.
He's got green access over here.
That's into muscle belly now.
Yeah. That's why it's so painful, isn't it?
That's going to be sore.
Can you lift it back up where it was?
Doctors fear that the blade may have cut deep into the muscle tissue, starving Tom's leg of blood.
It's important to make sure that there's good blood flow in the blood vessels further on down from the wound.
You wiggle these toes for me. Good man, okay.
If there has been significant damage, that can result in impaired blood flow and in worst case scenarios may result in an amputation of the leg.
You're on the side here? No, I can't feel anything. Well, do it again. There? No, I can't feel anything there.
It did start to hit me. You know, I'm in trouble here.
There's nothing down here. No, I can't feel anything there.
I was thinking, if this is the worst case scenario, I've got to be prepared for it.
Speed it up, otherwise we'll be here tomorrow, mate. Yeah. All this fuss for a sprain, I might as well just walked home.
Daddy, the back of my head really hurt.
Does it hurt, honey?
The back of your head now?
Okay.
It's been an hour and a half since Issa arrived in resus after being hit by a car. Initial scans revealed that he has a collapsed lung.
Isaac, hi, it's Yasser, how you doing? I've got a child in resus. He had a CT head to pelvis because the surgeons were concerned about his abdomen and plus the mechanism. And
Yasser will need to determine whether he has other serious underlying injuries.
Issa, oh my God, I can't believe how brave you are.
Is he your youngest?
He's my second. I've got two younger than him at home. All my life revolves around my kids. And I've got that from my mum. She's sort of taught me to be strong. She was a very strong woman. She kind of like raised us on her own. She played, you know, a massive role in my life. Yeah, look, because we're just literally just waiting for some results. And as soon as the results come, if everything's okay, you can sit up and then you can have a bit of water, yeah? 3 months prior to being pregnant with Issa, my mum got diagnosed with leukemia. And through my whole pregnancy, I took care of my mum. I was, you know, doing daily trips to the hospital to be with her. I'm gonna get water in a minute, okay, John? Not in a minute. My whole life revolved around caring for her, spending that time with her. And I remember every day of being there with her. I remember every single day. I remember the day that she passed away.
John, I have to go home.
Not tonight, honey, but you're going to have a sleepover.
You're going to have a nice sleepover in the hospital.
I'm so jealous. I think it does play a big role, the fact that I was pregnant with him when my mum died. I felt he kind of like went through that journey with me.
Does it hurt now a middle bit?
A little bit.
A little bit, okay.
I mean, that void obviously will never be filled, but he did a very, very good job in terms of helping me move on. I love you. He just has this something that really connects me to my mum. He was, you know, one of the best gifts I've ever had.
he's vomited now 3 times in total, once since the CT. The reason I'm calling you is because they're not sure if it's a small extradural. Any child that's been hit by a car, you know, because of the height of the child, it might hit them in the head or neck, chest, and actually that may lead to much more significant injuries than it would in an adult. So I'll just give an update to have a closer look at the images now. So there is a concern that whether there is a small subtle bleed around the brain, okay? You know, is this something potentially, because it's difficult to say 100%. As well as like a collapsed lung. Issa was found to have a small bleed in his brain. There was a concern about a critical head injury. I'll speak to the neurosurgeons, they'll have a look at it, and we'll go from there, all right? The parents They want to know, is my child going to be all right? And it's difficult to be able to give them an accurate answer very early on.
You've been such a brave boy.
Of several kinds of cat, and my opinion now is that you should need no interpreter to understand our character.
Retired actor Donald came into St George's earlier with pain in his bladder. Dr. Fahim has been assessing whether the pain stems from an infection.
We do a bladder wash. I'll just check if you've got any urine in the bladder, okay?
During my life, I have been blessed. And I'm very happy that we've got two lovely children, a daughter and then a son.
Okay, nothing in there.
It's all right, is it?
Yeah, it is.
Thank you, dear. Both my children are in the film business. My son providing equipment, and my daughter is in the British Film Institute. She vets scripts. And to say, yes, that's a good one, no, that's not such a good one. Our daughter's down at Cannes at the minute, at the Cannes Film Festival. We had a lovely house in Sheen with an attic, which I made into a cinema. Even had a projection room, you know, with projection holes, so we used to put on shows up there. We hired the amazing Mr. Blunden, and this was a film which we hired for my daughter's birthday. And I enjoyed doing that with my children. And it's nice to think that as a result of seeing that film in the attic, my daughter went off into the film business. I may be wrong, but I got a feeling that might have been one of the many things that helped her to do that.
Your blood tests are all fine.
Blood tests all right, okay,
Yeah.
fine.
After your tea, I think you can go back home.
Right.
Yeah, what I would suggest is drink plenty of fluids.
Yes.
And if you get pain, then just take a couple of paracetamol.
Thank you very much. I like to think I've done the right things with my children. They are my greatest joys.
With no sign of an infection, Donald will be sent home.
Take care. Pleasure.
It's been less than an hour since 26-year-old railway worker Tom was brought into resus after cutting through his leg with a circular saw at home.
I lost concentration. The disc was still spinning after. Just rushed into the leg and ate into the leg.
Is it the pain's a bit better?
Yeah, I've got it in the right position.
Yeah, it's because it's gone through your muscle, so any movement of the muscle is going to be sore.
Yeah. Thanks guys.
The wound is so deep that doctors have ordered a CT scan to see whether he has any life-changing injuries.
And have you contacted any family or anything yet to let them know you're
Not
here?
yet, I don't want to worry them. I don't want to worry. It's my family, they don't take stress well.
Do they know?
No. My family from Colombia, South America. That's where I was born. I came over when I was maybe a year or two old.
Oh, look, you're doing very well.
Thank you so much. Colombia, in the 80s, it was probably at the worst time. And they didn't want us being in danger. So my family wanted to come to England to have a better life and to have a better life for their children.
Very nice.
Yeah, he is.
What's happened to the circular orange? Yeah.
My parents are originally farmers, so they had to sell their farm and everything to come here. It's a big sacrifice. It's the country where they lived and grew up. Could you lift my arm up?
Yeah, certainly. All right.
Thank you. My mother didn't speak English. She had to start from a very low-paid job, working in kitchens in schools. And then my dad, he was looking to be, for farming work. So it was a struggle for a while. It makes me feel a bit emotional because I felt very appreciative for it. Yeah.
All right.
Thank you very much.
You're welcome.
You've been great.
Can we do it the other way, my love? Try and get it off with some gel. Come to the sink.
Yeah.
How long has it been swollen like that for?
Now 3 hours, 4 hours
Okay.
now.
We won't cut them off easily.
No.
No.
Ah, Manas.
Are you okay there? Do you want to sit?
Yes,
Nice deep breaths, okay? You're doing really well, really well.
Oh, I'm sorry.
That's it.
Has it moved a bit?
Concentrate on your breathing. Forget about what we're doing.
Okay.
Let me see this ring cutter, sweetheart.
Keep breathing.
The baby would have been born by now.
Do you know what you might have to do, Caroline? Is just ring. I know it's strange, but ring the local fibres and ask them if they've got. Yeah, just ask them if they've got a small ring cutter. They could come and do it for us. There's so much.
It's swollen now.
Yeah. Look, I think it was swollen before.
It's Issa, how are you doing? I've certainly cleared his neck, so I've got him sitting up now, giving him a drink of water. But yes, he's awake, he's orientated.
Earlier today, Issa was hit by a car. He has a bleed on the brain and a punctured lung.
Did you like that drink? Do you want to have another little sip?
So I'll give an update. We're just going to observe him overnight, as there potentially queries as to whether there's a small bleed. Again, it just needs observation. We'll give him lots of pain relief overnight. I've spoken to the paediatric surgeons who are going to admit him overnight, and they'll just keep an eye. Okay, cool.
Thank you.
That's fine.
I've got 4 boys over the age of 2. I want them to grow up humble, loving, be thankful for everything that they have and have a good impression on society.
Daddy, I've got a tummy ache.
You've got a tummy ache? Okay. You've got a lot of medicine in you. And you did get hit by a car as well, so that must be hurting a bit. When my mum and dad came over from India, they had to build everything from scratch. And now we are successful in our lives. Like, I've got my own building firm and my family.
I'm so proud of you, so brave you are.
Champion. I look at my dad's commitment as a foundation to see his children and grandkids growing up and succeeding in life and what they're doing. I think that's the biggest, accomplishment for them.
You're gonna go upstairs now and you're gonna have a nice little sleep, yeah? I love you so much.
Issa will be admitted to a ward for further tests to determine whether his injuries could be life-changing.
Hi there. Are you waiting for the ring to be put on? We are, yeah. Can I have a quick go as well on Paul? Hello. Oh, bless you. Sometimes we can get it off with some gentle...
I know, she was trying, the poor thing.
Can I try?
It's not coming off for crazy. Oh, you are an angel. I'll take you to... Shall I bring you some wine? I'll take you to dinner. chocolate
Do you know what?
separately?
Your thanks is enough.
No.
Thank you so much.
Yours.
Bye-bye.
Is it meant to make that noise?
Yeah, you're meant to. That means it's working.
26-year-old Tom came into resus earlier, having sliced through his leg with a circular saw.
No, but it's gone through all that muscle, belly. What muscle would that be? And then rectus.
Doctors are examining Tom's scan results to determine the damage to his muscle, nerves and blood supply.
How's it look in the scan?
It is down all the way down to the bone. You've got a little spike of metal in there as well, so we need to get that out, wash out all the bone, and keep you in for antibiotics after that. So
Okay.
I'm just going to leave you with the
So,
anaesthetists and nurse.
are you just going to stitch it together?
It looks like it's going to be a bit too large to stitch, so you might have a vacuum dressing over it for a little while. So it's lucky, you didn't get your artery, that's the main thing.
Tom will be taken to theatre, where he'll have emergency surgery to his leg.
It's not easy, you know, coming from nothing. When my family came to England originally, my mum, she had to learn English and study. And at one point, my mum had, I think, three or four jobs. And then she's now an accountant, so she's come a long way from where she was. The main thing they taught me is the value of hard work, really.
You're waiting for them.
No worries.
Not ready for you yet.
I don't want to hold up anyone.
You're not holding up anyone.
Immigration is inevitable. People have to make these choices, go different places to better things in their life and better things for their children's life. It's part of being human. Yeah, you've all been really good.
Oh, that's nice.
Fantastic. I really hope David Cameron has mercy on everyone. Because I really don't think there's good things coming. But I will protest for you guys. I'll protest.
Thanks very much.
I will. I'll be there. I'll protest against Cameron.
This shift has just flown by. This shift has just flown by. Just suddenly looked up the clock and it's like, it's nearly home time. St George's Hospital's had quite a big role in my life. My father was a patient here for many, many years. In fact, he had the first ever kidney transplant at St George's. He passed away a few years ago now. There's certainly something very emotional about coming back and working in that same hospital. And I think for me, because my father was always a very, very strong influence on my life, I try my best to sort of think about all the things that he taught me and try to do the same things with my own children. Gee, all right, fine. Let me just finish.
Yeah, no, it's just that.
If I end up being half the father that my father was to me, I think I'll have gone a very long way and my children will be very, very happy with me.
I'm very grateful to be coming up to my 86th birthday. I won't get up and do a tap dance, but I think the answer is keep going at all costs. That's my motto, keep going at all costs.
I'm the first person in my family, immediate family, to buy property. And I've basically raised all the funds myself, worked very hard. Coming to England, it was the best decision they could make. And as you know, I'm a good testament to show that they made a good choice, I hope.
was scary at that time. It was scary because it was just sort of a waiting game. You know, is it going to be permanent? And it was heartbreaking because there's nothing you can do. There's nothing you can do.
I believe that when you have children, you're not living for yourself, you're living for them. And when I sort of see that they're going towards a certain goal, I would then sort of like 100% be behind them and committed to them in whatever it is they're doing.
What do you want to be when you grow up?
A doctor.
Why?
Because they help people.
What will you tell your brothers about cars?
I said, wait. I said, be careful around the road and look side to side.
Crack, I heard it.
Keep breathing, Dan. Good boy, keep breathing.
And how often do you fall? Never. You never fall? No.
Hello, St George's.
Really got to be quick here. The heart rate of 250 is a genuine medical emergency. I'm going to electrocute you.
Everybody clear? We shot coming up, sir.
I thought, my God, this is bad.
Boom.
Thank you.